Welcome to Conversations with Tom Shorkey. Conversations explores the past, the present, and the future of the communities in which we live through the eyes of interesting individuals. Now let's join our host, Tom Shorkey.
Welcome to Conversations. I'm your host for today's program, Tom Shorkey. With us today, our special guest has been part of this community for well over 30 years, very recognizable from many hats that he's worn. But today our guest is the Chief Medical Officer at St. John's River District Hospital in East China, Dr. H.Lee Bacheldor. And it's my pleasure, Doctor, to have you as our guest today.
Mine as well, Tom.
Now, you know, a lot of people know you. You've been part of the community, thousands of patients probably over the 30 years or whatever. But I don't know if our audience at home has the foggiest idea how you got in this business, where you grew up. So tell us, where'd you go to high school?
I went to high school in Berkeley, Michigan. I was a Berkeley Bear, graduated back in 1974. And my path took a few turns before I ended up here in St. Clair. When I got out of high school, didn't really know what I wanted to do, and I wasn't one of those folks that wanted to be a doctor from my youth. So I went out in the work field and worked in construction with my father for a year, and my father made sure that I didn't want to last in that occupation. He made sure that I had every dirty job there was, so I would go back to school and get an education.
And where did that school end up?
So I ended up going to Schoolcraft College, and I started off in the biomedical technology engineering program there. Got an associate's degree there, and as a result of that, you do an internship or some time in a hospital. I ended up doing some time at Sinai Hospital and ran into a cardiologist there who had a research program going. And I did some research for him for a few months and decided that, gosh, maybe I don't want to be a biomedical technician. I want to go into medicine. So I explored going back to school, went back to school at Albion College and spent 2 years there getting a chemistry degree. Graduated and then applied to medical school and went to Michigan State College of Osteopathic Medicine for my medical training.
And then from Michigan State, where did you do your residency?
So from Michigan State, I went to Mount Clemens General Hospital and trained there, and was contemplating going into a cardiology field, doing an internal medicine residency and cardiology fellowship. Unfortunately, I met a girl named Pam there in the ER, and Pam, who is now my wife of almost 30 years, influenced me to take a less lengthy path. So I went into family medicine and partnered with a fellow by the name of Charles Angina, who had a practice in Richmond. And Chuck and I were partners and opened up an office in St. Clair. He had an office in Richmond, and then eventually I bought him out and stayed in St. Clair.
And you were a one-man band for a while after you bought out Chuck?
I was a one-man band for 7 years, and then after 7 years, I found that with the changing times and the need to have some coverage when I was out of town, that I needed to be part of a bigger group. So I started talking to Mark Hamilton and Jeff Lucas and the practice that had been on campus there before me, and we kind of merged our practices together, built a building, and put us all together. That was 23 years ago.
Wow, and that is River District Family Practice.
Correct.
Is that now family practice? Very integral part of the whole medical chain for people, and with the rise of urgent care and walk-in clinics, emergency rooms, how does the family practice fit into all that?
Well, family practice fits in as we're the big coordinators of care. We make sure that you're getting all your preventative services that you need. We make referrals to specialists. We make sure that you're getting the care that you need in the right place at the right time. There is a saying now that we're trying to go for the quadruple aim, which is customer experience, provider experience, better cost, and satisfaction. So, and customer satisfaction plays a big role. So family practice is kind of your overall care, making sure that you're coordinated, you need to be in the right place, you get to where you need to be, and getting the care that you need.
So on a short-term basis, if somebody had an emergency at home and cut their finger wrapping their Christmas presents or whatever, going to an urgent care is one thing, but you really can't rely on that for consistent care. You
Correct. That's
you need
more
a base.
yeah, that's episodic care, and so then you get the stitches put in, but you need to have the stitches taken out. So you need to have that wound evaluated. So then you go back to your family physician and make sure that wound's healing well and the stitches get taken out. Urgent care is episodic care. They don't really have a longitudinal base. They don't have a long, a history of everything that's been done with you. They go in and take care of that immediate problem, and then you go back to the family physician or your primary care physician. Not only family physicians, but internal medicine physicians are primary care as well.
And it seems like we are in the era of specialists in medicine. It's almost, whether it's cardiology or cancer, orthopedics, whatever. Do young physicians still opt for family practice, or do you almost have to have a special field for people to go into family practice?
We have to have a special field. You have to want to go into family practice. Nowadays, medical school is very expensive. Kids are coming out with huge numbers of debt. We interviewed a pediatrician and a family physician. Combined coming out, they were $700,000 in debt.
Holy mackerel.
So you look at a starting salary of a family physician compared to a starting salary of an orthopedic surgeon, a cardiologist, a radiologist, which is more than double what the family physician gets. The lure of getting that higher revenue and salary and paying back your loans is hard to get over. But we're trying to do some things. We have some things with loan forgiveness where we're trying to get family physicians involved and paying back, helping them pay back some of those loans, so that we're getting more folks interested in family medicine. It's rewarding. You really get to, the specialists see the patient and they see them for that one problem, but you get to see them for everything. And in my 30 years of practice, I really have developed some great relationships. I have, since coming to town, my wife and I have become parts of families that, we are not part of, but we're really, really close to them and have made great relationships throughout the years.
And the other thing that seems to be on the rise is like testing and screening for, a variety of things. And at some point, is there too much testing and screening? You read about, older people with mammograms that don't need them, or there's been a lot written on the PSA test for prostate lately. I mean, how do you do that balance?
It's kind of tough. Some research comes out and says, if you want to take PSA as an example, that PSA tests cause more harm than good, and they cause people to go through more testing and maybe biopsies, which potentially could be harmful. There is research that shows they're beneficial too, so that argument is still out there, and urologists are saying, yeah, they need to do PSA testing. It's probably the best thing we have to diagnose prostate cancer at this time. They do say that prostate cancer is a slow-growing disease and that most people will die of something else other than prostate cancer if they live long enough. But there are some folks that have aggressive forms of prostate cancer, and we do pick those up by PSA screening. There is, a movement underfoot to make sure that we do provide appropriate testing, and there are many organizations that provide us kind of guidelines on what to test for. Radiologists have their group that provides guidelines, breast surgeons for mammograms. There's all sorts of research that comes out, and it changes probably on an every other year basis.
Do you, with family practice, when it comes to X-ray, MRI, CAT scans, how do you determine?
You determine based on what you're looking for. So if you're looking for like a central nervous system object or something going on in the brain, the spine, MRI is much better for that. If you're looking at internal organs, liver, abdominal things, chest things, CAT scans are better for looking at that stuff. There's PET scans, and there's newer scans coming out all the time. CAT scans, we have a 64-slice CT at River District Hospital. Now there's a 128-slice CT, and so technology improves as time goes on. In the mammogram world, we were the first to put a digital mammogram at River District 5 years ago, and now that's obsolete, and now we're doing 3D mammograms. So technology changes, costs go up.
Costs go up, and well, let's segue into River District a little bit. Now, a few years ago, you were a full-time family practitioner and with your group, and now as part of the St. John's system, you are the chief medical officer, which you have been for a number of years.
Right.
But when Frank Poma went on to another assignment after being the head man at River District, you have been kind of plugged in for more administrative duties along with somebody in charge of nurses and somebody in charge of operations. So you have a lot more responsibilities at the hospital, where it's your practice is now 1 or 2 days a week.
Correct. 1.5 days a week. I work in Mondays all day and half a day Thursday, and then the other times I'm at the hospital or usually at other system meetings. I could be anywhere from down at St. John Hospital Medical Center in a meeting, or at our corporate offices at 11 in DeQuinder, or up in Grand Blanc at Genesis, which is centrally located for all of our Ascension hospitals in Michigan.
Talk about Ascension for a minute, because there are many people in this Blue Water area who, that's still River District Hospital to them, yeah. But it was St. John's River District Hospital, and now it's going to get a new name. Tell us just a little bit about Ascension, and what's the benefit for being part of that Ascension system?
So Ascension is the largest not-for-profit system in the country, and we've been a part of Ascension for, almost 10 years now, but we really haven't brought the name out there or the brand out there. So there has been a movement in the past 1.5 years to bring that brand name out across the country. So Wisconsin and Michigan are the first 2 states in the country to kind of adopt the Ascension name. Crittenden Hospital in the state was the first one to be branded as Ascension, so to speak. So they are now Ascension Crittenden, and there's signage throughout the hospital. And slowly but surely, and as you can imagine, when you're going to change a name, you got to change signage everywhere, literature, all sorts of stuff. So, it's a slow process, but we're rolling out across the state to name all the hospitals with the Ascension brand name. So it gives us some economies of scale. It certainly has, it's made more things kind of a national instead of a regional structure. Human resources, recruiting, management of finances, budgeting, some of that stuff is more done on a national basis than a regional basis. Some of that we find good, some of that we find to be a little cumbersome.
A little more bureaucracy involved.
Right.
Well, and I think with River District, for the first 30 or 40 years of River District Hospital, they had their own River District Hospital board, but that doesn't exist anymore, does it?
No, we haven't had a hospital board in a few years. We still have what's called the St. Clair Advisory Board, which is where we have a number of the previous board members on there, and we meet with them every quarter, go over what's happening at the hospital and get a feel for what they're hearing in the community to make sure we're in touch with what's going on. But we do have a regional board. We have a St. John Providence regional board, which is overseeing the hospitals in St. John Providence, which are our hospital, St. John Hospital Medical Center, St. John Macomb and Oakland Hospitals, Providence and Providence Park Hospitals. And then there's a larger board over the Ascension, Michigan.
At River District, or through family practice or other physicians in the area, River District performs surgeries, but not the real, how do you want to say it?
So we don't do the high-risk surgeries, the real intense surgeries. Yeah, we're a good community hospital. We do the bread and butter stuff really well. So we have general surgery, we have ENT surgery, orthopedic surgery, gynecologic surgery. We have an anesthesiologist that does pain management. We have Dr. Balak that does ophthalmology surgery there on Thursday. So we do a broad base of just the general, general medical stuff and general medicine. And then we leave the kind of the big stuff, the big open heart surgeries, the lung surgeries, major abdominal surgeries, pancreatic surgeries to the experts at the major hospitals. And you don't want to replicate that stuff everywhere, because you want to go to the person that does many of those every year, not the person that does 1 or 2 of those every year. So that's why we have the St. John Hospital Medical Centers, we have University of Michigan, all those other major centers.
And I think that makes a great deal of sense.
Yeah.
Is it difficult to, because there's so many specialists now coming out of medical school, is it difficult to recruit physicians up to an area like ours as compared to more the Ann Arbor's, suburban Detroit, Grand Rapids type area? What are some of the problems with that?
It's difficult because everybody wants to live in the now that Detroit is so becoming an up and coming city, people want to live near to the Detroit. So they want to live in Grosse Pointe, they want to live in Troy, they want to live in Bloomfield Hills, and so driving up here is kind of a problem for them. Once they get up here, they like it. Most people come up and they say, wow, it's a great little place and it's a great area. We have the river, the Blue Water area. We have a lot of things for them. And we're not that far away from down in the city, so to speak. So it is tough to recruit. Where some specialists are tough than others because they like to be close, and especially if you have to be on call and you have to drive in in the middle of the night, it's a distance to get up and come in, where if you're in Grosse Pointe and you go to St. John Hospital Medical Center, it's 4 minutes. So
How about let's talk emergency rooms for a minute. Those are always kind of a hot button. If anybody has lived in the area like we have, you can probably count the times you've been over to that emergency room with somebody's sprained ankle or injury or cut, whatever. But emergency rooms are an expensive option for people. How would you tell our audience, when should you go over to the urgent care and when should you come to the emergency room?
So for the minor illnesses, after hours, on the weekends, when you have a cut, as you had mentioned earlier, you have a sore throat, a cough, you don't want to wait until Monday to see your family physician. Urgent care is wonderful and it's great. You get in usually and get out. It's a lot less costly than the emergency room. The copays for urgent care are a lot of times half to sometimes even a quarter less than what an emergency room copay would be. Nowadays, we all have insurance that has high copays and deductibles, and sometimes you hear stories of people having $2,000, $3,000, $4,000, sometimes $6,000 deductibles each year. So that money is, that's money well spent when you have a minor injury. Now, if you have symptoms of chest pain, you're out shoveling snow, you're short of breath, you can't breathe, you think you've broken something, you need to get, some treatment right away, you have signs and symptoms of a stroke, you need to get into the emergency room, and that's where they have that level of expertise and the technology to rapidly diagnose and treat. We have some great things now. We have the opportunities with telehealth, which is where you get a doctor on a television screen, and we have that in the emergency room now. We pilot it with strokes, and so we have neurologists they're part of a centralized stroke team throughout the health system, St. John Providence Health System. So if a person comes in with symptoms of a stroke, the emergency room physician, we have a protocol where we do certain things to diagnose right away, get a CAT scan immediately, make sure it's not bleeding into the brain, do an evaluation, and then we pull up on the screen a neurologist on call, and they evaluate the patient, they talk to the patient and the family, and they decide if they need TPA, which is a medication that breaks down blood clots in the brain, or if they're a candidate for further studies, which now they have neurovascular specialists that actually can, if you're beyond that window of TPA, they can do a catheterization, put a catheter up in your brain and kind of pull a blood clot out and save brain tissue. There's some amazing things that are happening in medicine now.
That's great.
Yeah.
Would there ever be a discussion of, because you're part of such a large system, the St. John system, and then the Ascension system, that a facility like River District would just become a dedicated ER type hospital with maybe a couple of other things rather than trying to be a full service hospital?
There's discussions there. We've had discussions throughout the years about that because we're a small hospital and we feed our major hospital, St. John Hospital and Medical Center. But it's always been felt that we have a need for hospital beds here for us and to take care of those patients that want to stay in the community. A lot of people don't want to drive to another facility. You see that they did something like that at 23 Ma Road where they opened up a freestanding ER and hoping that patients would then go to the ER, and if they need to be transferred, they go to St. John Hospital Medical Center. Sometimes it didn't always work out because they say, well, I'm going to go to Henry Ford Hospital, which is only a few miles away. Mm-hmm. So St. John has looked at that, but they've decided that we kind of send a lot of business down to the main hospital and also the specialists down there. It's a benefit to keep our hospital open. And we have a lot of the specialists that come up and see patients here. So we have surgeons that come up from St. John Macomb Hospital in Warren up here. We have the cardiologists from St. John that come up here and see patients up here. So we really have a good tie with the health system.
Like, a lot of small hospitals like peppered throughout Michigan have closed just because they can't keep up the pace. They can't update the equipment. They don't have the employees. They can't recruit the doctors. Is there ever any chance of River District not functioning?
I don't know. We have to see what happens in the future. I don't have the crystal ball, and change certainly is the word of medicine. I think I see us still being here. I think I see River District still being around for a while. We'll have to see what happens in our region with the other health systems and what takes place. So I can't say I can see that happening in the near future.
Competition Is it severe between the different hospital systems? I mean, you got McLaren sitting here, and I don't even know who Beaumont's part of, or you have Trinity and Ascension. I mean,
there's a lot of competition in healthcare. Everybody's looking at the numbers, who's number 1 and 2 for various things. We watch that data very closely. We get a report each month called the Beaumont Report that tells us the admissions and length of stay and everything for all the hospitals in the area, a number of data points. But our local area, there's probably, we're far enough away from Port Huron, so we let the 2 Port Huron hospitals duke it out and see what happens up there. But, you know, Mercy or Trinity sold Mercy Hospital to Prime, and it's now Lake Huron Medical Center. So they and McLaren and Port Huron we're going to let them just kind of see what happens up there.
Now, and a hospital the size of River District is, I'm assuming, is not self-sustainable. I mean, does it need, when you talk about the equipment and how fast the technology changes, I mean, are they, does the St. John's system
St. John helps
help
us out.
balance the books?
They do. They help us out. You know, we sometimes work at a deficit, but we also give a lot of downstream revenue in those, the neurosurgeries, the cardiovascular surgeries, sometimes the specialized orthopedic surgeries. So there is a benefit they get from having us here. We are making progress, and hopefully in the future we'll be able to be a break-even institution, but we'll see what happens. We certainly have a lot of help from our benefactors in the community. We have a lot of philanthropy that helps us out as well.
And volunteerism?
Great volunteers. We are blessed by having a number of volunteers that give a lot of time and effort into making sure we operate as smoothly as we do.
Tremendous.
Yeah.
Who's been an influence in your life?
I would say, you know, my wife certainly has been a great influence in my life. She's been wonderful. I would say in my early years, Chuck Angina was an influence, getting me, you know, in medicine, getting me going. And then, you know, Frank Poma. Frank and I worked together for a number of years, and he certainly had helped me out an awful lot, and I looked up to him and his decisions quite a bit.
What would, you know, we have a lot of very talented young people in our high schools, and if someone was interested in a medical career but didn't know if they wanted to, you know, bite off that being a physician and the amount of time and the expense involved with medical schools, are there options for kids who want to be involved in the medical field in some way but not necessarily a physician?
Sure. There's radiology technology schools in the area where you can be a radiology, an X-ray tech, an ultrasound tech, MRI tech. You know, that field has been specialized too. Before, it used to be an X-ray tech and you'd take just pictures, X-rays all day. Well, now there's specialized in ultrasound, there's specialized for MRI, specialized for CAT scan. You can be a lab tech. You can get a bachelor's degree and work in the lab, run testing in the laboratory. You can be a physician's assistant, go to nursing school. There's a lot of kids going. Nursing school probably is more difficult than medical school to get in nowadays. Nursing school, then you can go on to be a CRNA, a nurse anesthetist. You can be a nurse practitioner, physician's assistant. There's a number of options.
What a physician assistant? We've heard that term often in the last few years. For our audience, what's a physician assistant?
So that's the person that works under the supervision of the physician. They see patients, they perform testing, they, you know, can do some injections, they can do a lot of what the physician does. They don't have as much schooling as a physician. They get a bachelor's degree and then they have advanced training after that. But they have to work under the supervision of a physician. They can't practice independently. Similar to a nurse practitioner. But in our state, nurse practitioners can work independently. They're allowed to do so. Not always within the health system, but they can go out and hang their own shingle and practice in the community.
Would, like your River District Family Medical Practice, is there a role for a PA over there, or is it for more of a specialist?
Well, no, they're in specialists and in primary care. We're seeing, because there's a shortage of physicians and a shortage of primary care physicians, we're seeing more physician's assistants and nurse practitioners, those mid-levels going into family medicine. In our practice, we've grown. We used to be 5 physicians, now we're 6, and we also have a nurse practitioner, and she's getting pretty busy, seeing quite a few folks.
Now, you have a big fundraiser coming up, a major event in this community.
We do.
Would you like to tell us a little bit about what's on the horizon?
So every year we have our dinner dance, which is called An Evening to Share. It's at Alexander's in Marysville, and it's on January 27th. At that venue, we always honor our Community Leader of the Year and a Physician of the Year. Last year, we honored Vicki Locke as our Leader of the Year and Dr. Mark Hamilton as the Physician of the Year. This year, we're going to honor Mr. Paul Dingman as our Community Leader of the Year.
Great.
Well deserving for all he does for our community.
Tremendous.
And then we're going to honor Dr. Ken Sun, who is our hospitalist, who has done a tremendous job making sure that patients get great care when they're in the hospital. For the first time, we're also going to honor Associate of the Year. So we've had a kind of an Associate of the Month voted on each month. And then we're bringing all the winners and their spouses to the dinner dance, and we have a silent ballot that we've already done, and the results are sealed, and we're going to announce the winner there. So it should be a fun night. It should be a great night.
It should be, and I hope you don't mistake the envelopes
No.
like they did at the Oscars a year or two ago.
Yeah.
Well, thanks, Lee.
Good.
For our audience at home, I hope you've learned a little bit more about Dr. H.Lee Bacheldor, who has been part of our community for a long time. Continues to provide leadership not only for his River District family practice, but for the St. John's system and being the Chief Medical Officer at River District Hospital. I think medical care in this community is on the right track, and if you've got any questions or concerns about River District Hospital, call the number 329-7111, I believe.
Got it.
And if you are feeling the effects of maybe a stroke, maybe chest pains, according to Dr. Bacheldor, that's when you go to the emergency room. If you've got a cough and a cold and can't wait till Monday, that would be the time to go to urgent care. And don't forget their January 27th dinner dance at Alexander's, where they're going to honor some outstanding professionals, including our own Paul Dingman from Cable Channel 6 right here in downtown St. Clair. On behalf of Channel 6 and our listening audience, thanks for being our guest today.
Thank you, Mr. Shorkey.
You've been watching Conversations with Tom Shorkey. Conversations explores the past, the present, and the future of the communities in which we live through the eyes of interesting individuals. If you have an idea for a future conversation, please contact us at www.watchctv.org. Thanks for watching Conversations with Tom Shorkey.